I'm Steve Kopetsky, cardiologist at Mayo Clinic, Rochester, Minnesota, president of the American Society for Preventive Cardiology. My discussion today was about LDL particle counts and when to use them in risk stratification of patients with coronary artery disease. And essentially what we talked about was that there are three ways to measure an LDL. One is the LDL cholesterol, which is the weight of the cholesterol. Second is the ApoB, apolipoprotein B particle. And the third is the LDL particle count number. And we discussed that one of the key things to the LDL particle number is that every LDL particle has an apolipoprotein B on it, and that is the most atherogenic part of the molecule. So that's why it's helpful to measure the LDL particle count. In patients that have low HDL or high triglycerides or high blood sugar are more likely to have a discordance between their LDL cholesterol and their LDL particle counts, meaning that with low HDL and high triglycerides, high fasting blood sugar, those patients will oftentimes have a LDL cholesterol that may be at satisfactory levels, but their LDL particle count is quite high. Again, the atherogenic part of the molecule puts them at greater risk for coronary artery disease events. So we pointed out that one of the things to do is patients that come into you initially with high LDL cholesterols, we do not need to do LDL particle counts because we know high LDL cholesterol, it's going to be a high particle count. However, the time to use it is once you treat the patient, you have them under relatively good control, they're either diabetics, they're metabolic syndromes, high triglycerides, low HDL cholesterols. That's the point to measure a LDL particle count. And oftentimes what you'll find is that while you thought the LDL cholesterol was quite good, in the 70 to 100 range, the LDL particle count is still quite high, over 1,000. And that's where we need to be more aggressive, either with more statins, more lifestyle change, weight loss, exercise, getting blood sugar under better control. And that can be very helpful to help you risk stratify your patients.